When I quit, it felt like I'd woken up from a nightmare. So I started working as a paramedic in Manitoba in 2019. I started the job when I had just turned 20 years old. People hear paramedic and they think, it's the lights and driving fast and, all types of like gruesome accidents and stuff. And there's a little bit of truth to that, but most of what we did was helping out, if it was elderly people who had fallen in the night and couldn't get up, or if it was somebody during the day whose baby had a fever and they'd never had that before and didn't know what to do. The bulk of our job was just kind of low stakes calls, but every now and then you would get the adrenaline pumping, high stakes situations, and all of it felt good to do. It's the only job I've ever worked that gave me like a real sense of purpose. So for us, the changes came during the second wave. Manitoba had done really well in the first wave. I think that most people thought that that meant it wasn't as big a deal as it was. And so when that fall rolled around, the government, just regular people, the healthcare workers, none of us were really in a rush to go back to the PPE usage and isolating that everyone had done before. And so our numbers really spiked in the fall.
Today we're announcing that the entire province of Manitoba is moving to critical or red on the pandemic response system.
So that was when the stress really hit because, our jobs went from something manageable that we had a handle on to completely uncharted territory with potentially really deadly consequences. We would go into the houses of people confirmed positive with COVID 2 to 3 to 4 times a day. It was pretty terrifying. The way a lot of us coped was essentially through work. We were able to talk about what we were going through with each other. But when that wasn't an option for a lot of people, it was alcohol and cannabis. For myself, it was whether I finished a day shift or a night shift. As soon as I got home, it was crack a beer and light a joint and just kind of try not to think about anything for as long as I can until the next shift. It wasn't a healthy way to cope, but it's what I had. We would spend hours sitting in the back of the ambulance with a COVID positive patient because there was no room in the hospital for them. And you kind of just had to hope and pray that you had your PPE on right, because after 5 hours of sitting next to somebody who's coughing and struggling to breathe, it's everywhere. When we pick up a patient, they are under our care. Once we get to the hospital, if there is nowhere for us to offload our patient right away, then that means that we have to stay with the patient until there is space. Oftentimes, there would be no space until a healthcare worker from the hospital has signed off on one of our pieces of paper saying that, yes, the patient is now the hospital's. They're under our care. Some nights we would spend 4, 5, 6 hours sitting next to somebody's mother, father, grandfather, and sit there and watch them struggle to breathe. We would have them hooked up to our monitor, really just hoping that it didn't turn into anything more serious while they were with us. It was frustrating. A lot of us signed up to be out helping people in our community. us sitting there would mean that ambulances from other towns had to come in to cover where we were supposed to be. COVID was going on, but people were still getting in car accidents. People are still having heart attacks and strokes. There was nothing worse than looking in the ambulance bay and seeing 3 of our crews waiting with patients and hearing a call come in just around the corner and knowing that we can't go. It's frustrating to feel like you're being held back in your job as a healthcare worker for what feels like bureaucratic reasons. We really gave it our all. We were burning ourselves out, trying to make up for what we felt was a lack of action, either by our healthcare system or our provincial government or our federal government.
There's no room in this hospital's ICU. Winnipeg's 2 other acute care hospitals also nearly full.
People talked about on the news all the time, what happens when Winnipeg runs out of hospital beds? And for us, rurally, it was already happening. So I lived and worked in the southeast of Manitoba. The town I worked in was essentially a hub for farming communities going, pretty much a half hour in any direction. So if people were protesting, they would come to town to say it. There were lots of people who isolated and wore their masks and stayed home, but it was the other group that was the loudest, I suppose. We had people protesting outside of our hospital several times, saying that it was a hoax, that it was exaggerated, that we were being bankrolled by evil billionaires somewhere, and that we were in on it. We had a man with his phone out filming, trying to get into the back of the ER, yelling that it was fake and that there was nobody actually back there. We were trying to do everything we could to keep people safe, and it almost felt like a slap in the face to realize that the community we were trying to take care of didn't want to take care of us in return. And that's actually a large part of why I don't live there anymore. One afternoon, I went to get groceries, parked, and I went in for maybe 10 minutes. And by the time I came back outside, there was a flyer under my windshield wiper for an anti-vax, anti-lockdown rally. And I saw red. Here I was, a healthcare worker on my day off who was seeing really sick people every day, and people in my town were spreading quite literally fake information. And I grabbed the flyer and I got in my car and I started driving up and down the aisles of the lot trying to find the person. I had no idea what I wanted to do, but I wanted to find them and I wanted to confront them. And so I couldn't find them in that parking lot, but I knew that just next door was another store with a big parking lot. So I drove over to that one and I started driving up and down those aisles. And I was maybe halfway through that parking lot when it was like a little light went off and I realized that I needed to go home and that I wasn't okay. That was when it really clicked for me how much stress I was under and that something had to give. So our operations manager worked across the parking lot from us, where the administration building was. And I never saw her once. Knowing what we were going through and how many of us were calling in sick and burning out, and never once checking in just to see how we were, or asking our thoughts on how things were going. That was hard. That really made us feel like we were just warm bodies keeping a truck on a spreadsheet in service, and not like we were people going through a really hard time and doing our best. When I quit, it felt like I'd woken up from a nightmare. But I lost a job that had given me a sense of purpose. I did try going back to it once afterwards, working in remote communities in northern Manitoba. There was just too much trauma there for me to do it again. I wish that my community had tried harder to help. I wish that our management had asked us what we needed or what we wanted or what we were going through. I wish that our provincial government had asked us what we needed or wanted or what we were going through. Just knowing that all these guidelines and rules were being thought up in an office somewhere at a computer, when we were actually the ones who were out there risking ourselves and seeing firsthand how things played out. I just wish someone had asked us. My identity has changed from being a healthcare worker to being a dad. And it has made me really happy. I love community. I love feeling like I'm helping. But right now, just raising my son to be a good person and to take care of others, I guess, is my way of contributing to community right now.